Okay, welcome back to ACT Program Webinars for Health Professionals. I'm Robin Geiger, SVP Clinician Advocacy for Ingenovis Health. Today, we are excited to welcome the founder and owner of Operation Happy Nurse, a web and mobile platform designed to help all nurses struggling with stress, anxiety, and/or depression by offering a community focused on improving overall mental health and physical well-being. I have the pleasure of introducing our speaker today. Shannon graduated from Purdue University in 2016 with her Bachelor of Science in Nursing. She started her career at MedStar Georgetown University Hospital in the neonatal ICU, but then sought out a career in travel nursing. Shannon experienced serious anxiety associated with the nursing profession, which inspired her to create Operation Happy Nurse. She's thankful for all the amazing people who've helped her create this stress relief haven, as well as those who've supported her along the way. And now, Ms. Shannon McPeek.
Thank you so much for that introduction. Man, I'm feeling special right now, but thank you guys. I'm so excited to talk to you about my journey and what led me to starting Operation Happy Nurse. I'm going to share my screen in a second, but I just wanted to apologize in advance if my dog barks or anything like that during this. He's feeling extra frisky because it's his birthday today. So he's excited. So let me go ahead and share my screen. So I started my career in the neonatal ICU. I started in 2016 over in Washington, D.C. And I love being a NICU nurse. I honestly think that being a nurse, there's just so many amazing things that you get to do day in and day out. But on the opposite effect of that, there's a lot of stressors that we have to deal with. And at the beginning of my career, I began to truly experience those stressors. So as I go through my story, if you have any questions at all, you can just comment them in the chat or send them to Robin, because she will be able to help me afterwards answer any and all of these and ask any questions that you might have throughout this presentation. So at the beginning of my career, I was so excited, and I wanted to give a quote to really show this. And throughout each step of my journey, I will have a different quote that really exemplified what was happening to me at that period of time. So this quote I wanted to state was, "Life on earth must be lived with wholehearted eagerness," because at the beginning of my career, I was so eager. I was so excited to learn. I was so excited to be a nurse. The hospital that I was at was a level 4 neonatal ICU. And for those who don't do neonatal ICU, level 4 is the highest level you can be. They also offered the ability to train me as a transport nurse. They had all of these amazing things available to me. And I was just so excited to be a part of an organization that had this culture of learning, that had this support that would really get me to where I wanted to be in my career. So I was so eager. But at the start, I did a nurse residency program, and we had our instructor, our clinical educator, who told us that we might be eager now, but at about 6 months, we were going to struggle. That when we were analyzing our feelings and emotions from the beginning of our career to our 6-month mark, that it would look vastly different. So we in fact journaled. We journaled at the beginning and we journaled at 6 months. And while she was telling me this, I thought that she was kind of wrong, that there was no way that that was going to happen to me, because I was just so ready and willing to learn. And I felt very good at what I was doing. But I was completely wrong in that situation. At 6 months, my journal looked vastly different than it did at the start of my career. So the quote that I chose here was, "The greatest weapon against stress is our ability to choose one thought over another." This quote I struggle with, because this is it's easier said than done. It's very difficult to choose one thought over another, especially when your anxiety gets so high. And my anxiety did get so high. At the hospital I was at, they like to use this tactic to tell us things that went wrong in other situations, to almost scare us to the point where I didn't really want to be human per se anymore. I wanted to become more machine-like, because a machine wouldn't make mistakes. A machine wouldn't miss something. So I started checking things 10 times over. I started looking at things more intensely, which, is important. It is important to double check things. But what I was doing wasn't double checking. I was obsessing. So I was unable at this point to choose one thought over another. And that's why this quote is so difficult, because it's such a difficult thing to do, to find and work through your brain when you are in such an anxious state. What was causing my anxiety during this period of time? Like I said, I felt that there were scare tactics being used, but also, not to mention, nurses are the last line of defense, right? So a doctor can write an order. If it's a medication order, pharmacy can approve that order. But if nurses give it, the blame tends to be turned towards us. People tend to say that it was our job to find that, to make sure that that error didn't exist, which it is. But at the same time, it's a system thing. So the doctor should have noticed it was wrong. Pharmacy should have noticed it was wrong. The computer should have noticed it was wrong. And honestly, a lot of the times when we are making these mistakes, we're put in situations that it's almost impossible not to make a mistake. There were points in the beginning of my career where I was taking care of babies that were, one of them would be intubated, another one would be on a high frequency jet ventilator. And in other states or in other hospitals, any intubation is a 1-to-1 because of the intensity, because of the acuity. So if you're put in a situation that doesn't really guide you towards success, it is very difficult to not make an error. And that is a system thing. That is not on you. But at that time, in my head, in my mind, any sort of thing that went wrong, anything that could potentially go wrong was my fault. Even if it was just natural causes, even if there was nothing that we could have done and that the world just had a different plan, I still blamed myself. So I entered this very, very dark period of time, starting at about 6 months. I started dealing with patient death. I had never really had to deal with death before. I had been to one funeral in my life leading up to this, and that was the funeral for my grandmother. And then all of a sudden, I started nursing, and I was going to funerals for infants. I was going to funerals randomly for other kids, for people under the age of 18, and I never had really had to deal with that before. I remember my first time to the morgue, and it was such a difficult experience seeing all of this stuff and then seeing just a baby there. It was something that is still so traumatic for me to think about. But throughout all this, as a 22-year-old, 23-year-old, really doesn't matter what age, death is difficult to cope with, especially if you took care of that patient for X amount of months. And even if you didn't, if you bonded with that patient at all, if you spoke to that patient at all, it is really difficult to deal with the death and dying process. When I first started nursing, I dealt with a lot of death and dying, and nobody checked in on me. We didn't have anyone come up and ask how we were doing. We didn't have anyone really mention anything after the fact. We didn't have debriefing. We didn't have chats. We didn't have therapists on board. We had nothing to be able to cope with this. And because when I'm looking around and I'm seeing everybody else seemingly coping fine, I just buried everything down. There was one specific circumstance where I had taken care of this baby for 6 months, and I bonded with the family. I bonded with the infant, and we ended up having to send this infant out for surgery. And this patient, unfortunately, did not make it through surgery. And this was so difficult for me that I almost sort of snapped, but I didn't know that I was snapping because I buried everything down, and my change in my personality, in my life, in literally everything was so slowly progressing that I didn't even realize what was happening to me. I started developing signs and symptoms of obsessive compulsive disorder. I now can clearly figure out where that came from, but I just found this out recently on a podcast interview that we were doing with an OCD specialist. This quote is amazing because it really, really defines what it feels like to have OCD. It can look like still waters on the outside while a hurricane is swirling in your mind. My OCD started because I was, again, wanting to become less human and more machine-like. So I started double, triple, quadruple checking things. I didn't trust my eyes. If I would read something, I wouldn't believe what I read. So I would take a step back, close my eyes, and redo it a multitude of times. This started in the hospital and then transferred into my personal life. So I started developing different compulsions. Like I would have to check the oven, I'd have to check the stove, I'd have to check my door, I'd have to check underneath my bed. I had to do all these things that I recently realized had to do with safety. And when speaking to the OCD specialist on the podcast, she said, well, yeah, that makes sense. Your job is to keep your patients safe. And when it's difficult to do, or when, you're in a difficult period of time within the unit and you feel lost at how to keep them safe, you have to find safety in another element of your life. So that was checking the stove for me. That was checking my locks for me. I was finding safety in that aspect. And for a while, my OCD went away. And then the pandemic hit. All of a sudden, I was cleaning absurdly at the hospital, at home. And I'm talking, I would clean things multiple times through. I would set aside about 20 minutes in my shift to make sure everything I remotely touched was clean, to the point where at one point I was even cleaning the glove boxes because my hand was going through it. And I thought, oh, there must be germs there. That started going back into my personal life again. I started developing other compulsions, and that all stemmed from nursing. I did not deal with this prior. I had never had OCD prior. And because of nursing and because of the stressors that I was under and the lack of support that I felt, this developed. Now, OCD comes and goes, it ebbs and flows. And right now, things are going really well. And when you do provide positive coping mechanisms for yourself, it is something that you're able to control, similar to anxiety, similar to depression, similar to many of those things. When you do have positive coping mechanisms available to you, you're able to cope with things in a better manner so that you don't develop things as significantly as I did. Clarity for me came when about, I would say, a year and a half into nursing, maybe just a little bit less than a year and a half into nursing, about a month after the patient that I spoke about earlier passed. I was dating somebody at the time, and they had told me they could no longer be in my life anymore because I wasn't as kind and compassionate as I once was. At that point, my personality was a little bit more subdued. There was nothing super significant. Those around me probably wouldn't have noticed that I was struggling as badly as I was struggling, but I was more reserved. I wasn't as outward with my emotions. I was a little bit more of a flat effect. And when he decided to exit my life, I realized that one, this person knew that I just lost a patient and decided to leave my life still. So I knew that I needed to do something about my mental health, that I needed to find ways to positively cope, because if I didn't, it was just going to keep going down from here. So although that situation broke my heart, it also kind of broke this trance that I was in. I was able to start researching different ways to get on top of my mental health. And I was able to then start speaking to other nurses. And in doing so, I realized that my situation wasn't unique and that it was actually a really large problem in the nursing profession. And this was back in 2018, 2017. So I did a study in 2018, and I asked a bunch of different nurses from different states, different specialties, and it essentially proved that this was a problem. We had statistics that showed that 80% of our respondents struggled from anxiety, depression, or a combination of both due to the nursing profession. And that was in 2018. That was pre-pandemic. So post-pandemic, as you all know, matters have gotten worse, but this issue has always been here. We have had a lack of resources. We have had a lack of acknowledgement that what we do is hard, and that's okay. That is why it is also so amazing, because from one end we see miracles, from the other end we see the death and dying process. And it's an incredible profession to be in. Not everybody gets to say that you get to save lives on the daily. I mean, we really are doing that. Without our help, without our services, no matter what specialty you're in, the world would be a vastly different place. So this profession is so amazing, but it is a difficult profession, and that needs to be acknowledged because we do need resources. So that is why I started Operation Happy Nurse. After speaking with a lot of nurses around me, I realized that we needed positive coping mechanisms and we needed community. Because while I was going through this really difficult period of time, I felt very isolated. I felt very alone. I felt very weak. Like, for whatever reason, I couldn't handle the profession that I loved, even though that wasn't true. It was just that I wasn't provided adequate resources. So at Operation Happy Nurse, our goal is to help all nurses struggling with stress, anxiety, and depression by offering this community of resources provided to not only improve your community aspect, improve your mental health and well-being, but to be proactive about it. Our goal is to decrease anxiety, depression, burnout, PTSD, and increase nurse retention in the meantime. We have members in all 50 states, the District of Columbia, and 6 provinces of Canada. Again, we're community-based. We have over 1,400 members on our website now, and we're completely free. I feel very, very strongly that nurses and healthcare workers shouldn't have to pay for their self-care when we literally spend our lives caring for other people. This should be a free resource. Our mental health should be free. Our mental wellness should be free. We offer a ton of different things, and we understand that not all of these things work for some people. So you pick and choose through what we offer, and then your profile adapts to meet your needs. So we have our book club, we have nutritional support, we have discussion boards, we have our Nurse Insights blog, TheraSpace blog. We have so many different things that we can offer you so that we make sure that we're addressing your mental health at all aspects. There was a study out, and I can find it and send it to Robin after this, that showed that by compiling different stress relievers, by compiling different resources, you're actually able to better cope. You're actually able to decrease your anxiety and depression better when using combination of things. We have 8 Operation Happy Nurse board members, 45 plus volunteers, and one of the most amazing things that we have right now is our collaboration with Ingenovis Health, or the ACT program. For those who are interested in really learning more about Operation Happy Nurse and for getting a little bit more in deep about your mental health and wellness, the ACT program and Operation Happy Nurse has this program called the Happy Nurse program. So what we do is we help you develop goals. We give you tips and tricks to developing your goals based on the resources that we offer. And with the ACT program, you not only get that, but you get classes from social workers, from guest instructors. For example, last week, Clayton Eckerd just came on to talk about bullying within the workplace, bullying in general, and was able to discuss that with our group. And you get access to these classes, not only on the day of, but afterwards as well. And we have a full library of these classes. So if it is something that you are interested in, or if it is something that you would want to join more hands-on, you can always talk to Robin or Ingenovis Health or any of the people that you're associated with to get this link to see the different classes that we offer, to see the tips and tricks that we have. Next month, we're also going to be bringing people on to actually work one-on-one with a social worker. So once a month, you'll meet with them to really understand why you might be having difficulties developing goals. Sometimes when your anxiety gets so bad or your depression gets so bad, it's difficult to even get out of bed, let alone start your mental health journey. So we're here to help with that as well. We want to make sure that everyone has adequate resources because what we do is hard. Again, we need to acknowledge that it's an amazing profession, but what we do is hard. And when we have people like Ingenovis Health, like the ACT program, like Operation Happy Nurse working together, we can truly make a difference within the profession and really make a difference within the lives of the individuals who work so hard to care for other people. So I'd love to answer any questions that you guys might have. But to close out the PowerPoint before we have open discussion, I just wanted to talk about this quote because it takes each of us to make a difference. Yes, it takes us focusing internally on what we need. We need to focus on our mental health, but the sense of community and working together is what really is going to make positive change within the profession. We are, again, in a difficult situation. It is a very hard profession to be in right now, and we need to acknowledge that. but together we can make mental health and nursing a priority, and together we can truly cultivate a career as lifelong nurses. Please let me know if you have any questions. I'm happy. I want to open this up to discussion and maybe hear stories from you all as well, because it is, again, it's important that we open up about this. What I was going through, I didn't think anyone else was. And as I've been able to open up about it, I've learned that, in fact, a lot of people were going through what I was going through.
Hi, Shannon. Okay, thank you so much for just being here and sharing your experience. Just so tuned in, I almost forgot to log back in and kind of chime on with you, but we do have a couple of questions. So if you don't mind, we'll get started with the questions.
Yeah, sure.
The first one that I'll send your way. It says Shannon mentioned at the beginning that she experienced unsafe staffing ratios. Is there any particular safe staffing legislation that she supports?
Yeah, so I currently work in California and it's amazing. So basically, there's a lot of different things that I support in there. I can't necessarily fully speak on all of them until Operation Happy Nurse can develop a for-profit sector, because in order to lobby or in order to do things like that, I do need a for-profit sector. As a nonprofit, I'm not allowed to really get political. But that being said, what I will say, I can tell you what I like from California versus what I was dealing with in other states. I was a travel nurse. I traveled in New York, Seattle, LA. I worked in Sydney, Australia, and then I worked in San Diego. I was staff in Washington, D.C. The only place that I felt has really had safe staffing is California. When I was in Washington, D.C., I was caring for, at one point, I would have 3 patients. If we were really busy, I'd have 3 patients, and 2 of those might be intubated. That is not, no matter where you are, that is not a safe assignment.
Right.
I took care of a patient, like I said, that was intubated, another one that was on drips and high frequency ventilation. In California, any intubated patient is a 1-to-1. Any patient that is normally on NIPPV, unless you're in specific circumstances, that's a 1-to-1. I took care of cooling kids. So for those who haven't dealt with cooling, we put them in that hypothermic state to save their brain after a traumatic birth. And in California, admitting that patient is 2 nurses to 1 patient. When I was working before in other states, it was, I would admit by myself that 1 patient, and it's in a very intense admission. They would sometimes have our charge nurse help us, but charge was also covering the rest of the unit. No matter what, pretty much CPAP patients, unless they were paired with an intubated patient, were with 2 to 3 other patients. In New York, I consistently had 4 babies and more. And for those that don't know, the normal for NICU is 3. Like, you shouldn't have more than 3, and that's 3 feeder growers, 3 maybe on like a nasal cannula, not anything where we're worried that they're going to crump respiratory wise, that sort of thing. So in New York, I would have 4 patients. There was one point where I had 4. I had to discharge 2, and then they gave me 2 more admissions within 1 shift. That's not an appropriate assignment. In California, they have break nurses. So when you go on breaks, you have someone take over your patient assignment so that you're not putting someone else out of acuity. So when, let's say I had 2 intubated patients back at Georgetown or in Washington, D.C., if I left, I would have to give those patients to another nurse who already had other patients to take care of. In California, they like have a nurse take over your assignment so they don't put someone else in a difficult situation. They also have admit nurses, and in other states, I would have a patient assignment if I was admitting. Whereas in California, you are an admit nurse, you don't have a patient assignment, you do the whole admission, and then you would give them, once they're stabilized, to another nurse. So things have changed a little bit in California, but I will say I felt the most safe caring for my patients in this state. and honestly in Australia than I did in many other states. So I don't know if I fully answered your question, but those are the things that I've noticed that have done well and that have worked and that are actively being practiced versus things that I've seen done poorly.
Right. So I think you answered the question perfectly. The question, just so that I can repeat this back to you, they were asking if there's active legislation that you support on safe staffing ratios. And I can't recall one that's openly active right now, unless you can, that you wanted to speak on.
No, I think
Right.
that right now, yeah, that is really what I'm looking and pushing for is to make other states have staffing similar to California. There are some changes in California again since
Right.
pandemic hit. It's a little different and the different hospitals do it differently. So I can't speak on every hospital, but the ones that I have worked at, that is what I've seen.
Makes sense. You have about 6 more questions, so we'll get started on those. Another question is, what would you say to help a nurse that loves their job but is starting to struggle?
I feel that so much. When I think back on it, because I love being a NICU nurse, I'm so proud of being a NICU nurse. And the thought of like leaving the NICU makes me feel very, very sad inside because it's just such an incredible profession to be in. What I would say is I would look internally. Are you picking up a lot when they're asking you to come in? Are you always saying yes? Because if you're noticing that you're working more than your allotted shifts, that might be one of the reasons that you're feeling burnt out. And although it is so, so difficult to say no when they're texting you consistently, sometimes it's more important to put your mental health first and your physical well-being first to keep you in that profession. So if that's one of the things that you might be struggling with, I highly suggest taking time to just work your allotted shifts until you can recover from that. Number two is, again, finding different stress relievers and different coping mechanisms that are positive for you. One of the things I really, really dealt with was I get very attached to the patients that I care for. And when something was going poorly, I would start looking at it totally irrationally. So let's say a patient died, I would find ways to blame myself, even if there wasn't anything I could have done differently. So now being able to take a step back and by having these positive coping mechanisms, I was able to actually look at these situations in a rational light and see that I couldn't have done anything differently. And if I could have done something differently, most likely there were other factors involved and it wasn't just on me. We have this whole, a lot of us tend to place blame because we need to make sense of what's going on. But a lot of the times the situations we're dealing with there's not a lot of sense involved in it. Sometimes things happen and we just need to be able to look at it in that rational manner instead of irrationally like I was. I would
Right.
literally find ways that it was my fault. So I suggest try not to pick up overtime while you're feeling this way. Maybe take a vacation and turn your phone off and ask to be taken off of their call list while you're on vacation. And also really try to do something for yourself daily. Even if you're at work, when I started getting back on top of my mental health after work, I would cycle for like 10 minutes. And that was a massive benefit to me. On Operation Happy Nurse, we offer like 1 minute breathing exercises. You could do that quickly. Do something for yourself daily because you are as important as the care that you provide your patients. And I think it's time that we realize that instead of always putting other people before ourselves, we can't care for other people if we're not also caring for ourselves.
Totally agree with you, Shannon, especially the guilt. I remember feeling the guilt when you were called for a second or third shift, or you're supposed to be on leave and they wanted you to come back and you're working just straight through 2 and 3 weeks at a time. That definitely causes burnout.
Yeah.
You feel guilty because you don't want them to be understaffed, but then you're no good if you go in and you're not taking care of yourself. So
Yeah.
definitely resonate with that. But yeah, that question really hit me for a minute because I remember being in that place. I
Yeah.
hope that answer was helpful for you. Um, The other question, oh, you have a couple. Let's try to get through these. The other question is Operation Happy Nurse available for ancillary staff as well, i.e. OR techs, CNAs, et
Yes.
cetera?
So right
That's
now we're under the nursing umbrella. So anyone who's underneath the nursing umbrella. So CNAs, LPNs, LVNs, NPs, RNs, anyone who's under that umbrella. Our goal is to duplicate it for other staff as well. For me, it was very important when I was going through my really dark period of time that I was speaking to people who understood what I was going through specifically. So as a nurse, my stressors are different than that of a doctor, than that of an OT, than that of a speech pathologist. Like our stressors are different. And therefore, I think it's important to be surrounded by those who truly, truly understand you. So currently, Operation Happy Nurse is offered for the nursing umbrella, but our goal in the next few years is to duplicate it so that we can be sure that we're providing care for everybody within the healthcare system. But for until then, I do partner with other nonprofits. Don't Clock Out is a peer-to-peer support group, and they have ones for everybody. Debriefing the Front Lines is a debriefing service, and they also are offered to all healthcare workers. And then Therapy Aid Coalition is therapy, and they are also offered to all healthcare workers. So until we're able to duplicate our services, those are available.
Thank you, Shannon. Yeah, and that touches on the next question that was from Elvin, asking how Operation Happy Nurse plans to expand its reach and impact in the future. So I think that would be the same answer unless you wanted to elaborate any more than
Yeah,
that.
we're also going to start research, and we are looking for help with research. So if research piques anybody's interest, feel free to reach out to me. But we are going to start researching it as well and seeing exactly the combinations that seem to work within our
Right.
resources, stuff like that. So we're going to start researching that. We are looking to, again, expand to other healthcare professionals. And we do a handful of in-person events, but I am looking to expand those. We go to different states, our main one being fitness for the caregivers right now. We hop around all over the United States and Canada. Every quarter, we go to a new city voted on by our nurses, by our healthcare workers, and that's actually available for all healthcare workers. But my plan is to create even more of those so that we're really not only a virtual community, but an in-person community as well.
No, I love that. And then you have another question from Rachel. What are some of the coping mechanisms and stress relievers that work for you?
I love this
And I know
question.
you mentioned a couple, like you mentioned cycling, but what other stress relievers and
So I'll go into what I was able to do when in 2016 before my resource existed, and then I'll go into what has been helping me now and kind of this story that I have where I hit a pretty dark period of time recently and what helped
right,
me in Operation Happy Nurse to get through that.
right,
So at the beginning of my career, I started working out more, a healthy amount. I wasn't becoming occasionally when people turn to fitness, it can turn into an unhealthy habit if you are in there for extended amounts of time and it's not a healthy relationship with that fitness. But fitness is what saved me. I was working out maybe 30 minutes a day, 5 days a week. I would go into the gym even after work for like 10 minutes tops. I like my sleep. I do. I don't want to go after work after a 12 and a half hour shift, 13 hours really when you get home, if not more, and then be in a gym for an hour. So I would do 10-minute workouts, whether that was cycling, whether that was weightlifting, whether that was something quick and easy just to release some tension. Reading also helped me a lot, being able to put yourself in another story and also see that like your feelings exist within the literary world too is just such an amazing experience. So I started reading a lot there. And then I started speaking to nurses. I didn't realize how badly I was feeling until I started talking about it. And honestly, just voicing it is such a relief and such a therapy for me. because I realized that I wasn't alone. And that is just such an amazing feeling to feel. Even if you're still struggling, to know that there's someone else who's struggling with something similar makes you feel strength in your feelings. Recently, I unfortunately lost both my grandpas within a 2-day span. And I was working in the hospital and I was starting Operation Happy Nurse. And it was just very difficult for me to get through. I started seeing a therapist. My OCD started coming back a little bit due to these pressures. And within Operation Happy Nurse, the ones that have really helped me are our guided meditations. There's a handful of them where if you just sit outside and you listen to their voice, it's like a whole different person comes out afterwards. I highly suggest trying them. It's been amazing. Fitness again works for me, and then our book club works for me, but also we have access to dietitians. So a lot of stress that I feel sometimes is eating healthy when we are working for so long, and they're able to help me relieve that and work through things with me and provide me with easy access to food and nutrition education. So that is another way that I was able to get myself out this time.
No, I love that. And, it's been great for us to partner with you with Operation Happy Nurse as the ACT program and Ingenovis Health, to have our clinicians be able to access the platform and utilize it. And there's one thing you haven't talked about the peer-to-peer or the circles
Oh
that
yeah.
are available there. But I think that provides some relief for a few of the clinicians as well, if you might want to
Yeah,
touch on
we
that.
do have discussion boards up. So I'll touch on that and I'll go into how that's developing. So on our website, we have these discussion boards where you can write a topic and your peer members can respond to it. And I think it's been very helpful for a lot of people to not only, it's almost like a journal entry, but then also to hear back from people who are similar to you. Some people just use it as a quick vent sesh. They'll write out something that happened as a vent and then they just let it be and they don't come back and respond because they just wanted to release it. So one thing that we do offer there though is the ability to write it anonymously. We understand that not everyone wants their name attached to something. So you do have that ability to respond and name and to write anonymously so that it can be a journal entry just for yourself and you don't need your name attached to it. We are building an application actively right now because we think it's important for it to be even more easy to access for our community. And within that, you'll actually be able to directly message other members and talk to them that way, directly message our social
It's
workers,
awesome.
directly message other people so that you can really get that community support there.
Okay. Thanks for touching on that. Wasn't trying to add, but I just knew that it was a
No, I
good
appreciate
resource.
that. Yeah.
And then, okay, we'll continue with your questions. I think we do have some more time. How do you recommend separating your work life from your personal life? This is a two-part question. What are the tricks you use to compose yourself before dealing with a stressful situation? Like if you know something is going to be really stressful, how are you preparing?
Yeah, this is a really hard question. And it's easier said than done, right? Sometimes when you're in those situations, it's really difficult to separate, right? You come home and something happened at work and I get a little snappy. And so I just don't want to be around people. I isolate myself and that's not healthy either. So one way that I'm able to, or was able to separate my work life from my home life is to give myself time, to not completely isolate myself, to not ignore the problem, but to sit with my feelings and acknowledge them before I move on.
Right.
So coming home and sitting in your room and thinking about or journaling about what happened, just giving yourself that 20 minutes alone to cope with it instead of pushing it away is so helpful to then be able to move on in your life. If you just keep pushing things down like I did, it's gonna come back. So acknowledging your feelings, acknowledging your sadness, allowing yourself to cry, it's okay. If you have to cry at work, it's okay. I was taught that you shouldn't show emotions, and honestly, that makes me really angry because you're just pushing it down then, and then 12 hours later, you might not want to think about it again.
Right.
Go to the bathroom for 5 minutes. Everyone's got to pee. Go there, sit there, cry, and then go back, release your emotions, and you'll be able to separate your work and your life a lot better if you acknowledge that you feel a certain way, even if those feelings are difficult. Because for me, I didn't want to re-feel feelings. If something was hard, I wanted to forget that it existed. But I can tell you from personal experience that that doesn't help. It's a lot better to feel those hard feelings in the moment than push them away. In regards to at work, when you know something difficult is going to happen, one thing that I found is really helpful to me is to start doing deep breathing to center myself. And I look at my hands. If my hand's not steady, you can trace your hand and do a mountain breath. So you pretty much go like this and you go like this. And on the in, when you're going up, you breathe in. When you're going down, you breathe out. When you're going up, onwards. And you can do that when you know something's about to happen, you're feeling anxious. You can center yourself that way. And then you'll see that your hands will start to steady, your breath will start to steady, and you'll start to feel ready to take on whatever it is you're about to take on. But taking even that 5 seconds for yourself, even when you don't think that you have 5 seconds, you're going to address that situation way better than you will if you completely ignore the adrenaline you're feeling, your heart rate that you're feeling, the stress that you're feeling. You're going to be able to handle it a lot better by just giving yourself 5 seconds to breathe.
Wonderful. And then do you recommend pre-journaling? Like if you know that there's something coming up, you mentioned journaling after, do you recommend pre-journaling or writing down if you're anxious, writing before the event that you're
Yeah.
going to face? Yeah.
If you are about to go into the hospital and you know you're going to deal with a difficult situation, for sure, write it down. If you're in the hospital, I would focus on breathing or mentally journaling, or even telling someone you trust next to you that's a nurse that you're feeling a little anxious. Just even voicing that is going to be helpful. Someone you trust, again, like you want someone next to you who is in your corner, who understands who you are, what you're going through, that sort of thing. But I do recommend journaling, and I need to practice what I preach here, but it is so cathartic.
It is.
It's so cathartic. So I do highly recommend that. Even typing it out on your computer or
Right.
writing notes. I have friends, Clayton Eckert, the guy who did the bullying for us, he's a big note journaler. So in his notes, he'll like write out a journal entry there and then start another note. So even if it's not physically writing it, just even acknowledging that or voicing it out is really helpful.
Right. I usually
Post
tell,
whatever,
absolutely. When patients ask me about sleeping, they're not sleeping. Journaling is one of the first thing I say. Just write down whatever you're stressed about before you sleep. You're
Yeah.
not going to sleep. So that I don't totally agree with that. Okay, you have 2 more questions. Well, one is a statement. You are just as important as the patient you're caring for. They love that statement that you just made. And the question was, do you have established relationships with anyone in the federal sector, such as HHS or VA, Health Human Services, or Veterans Affairs?
I do not yet, but that is in my plans in the future. I work closely with other healthcare nonprofits, and our goal is to work together and form a separate for-profit to be able to work directly with organizations like that and make more change on that level. In the nonprofit world, it's a little tricky, but that is in my goals, is to create a for-profit sector and work with the other healthcare mental health nonprofits to really establish change and get in connection with those types of organizations.
Okay. And then last question for you from Andrea. I've experienced bullying in nursing, and as a result, I also experienced PTSD. I would like help and wonder if you could provide more information. I think she wants more information about PTSD and bullying, if you have that.
I do. If she wants to email me, I can send her direct things that we have there.
Okay.
My email is shannon@operationhappynurse.org. And honestly, anyone and everyone, email me if you have more questions, if you want more information, if you want to learn more about our partnership, please email me. And I have a lot of good articles and good stuff about PTSD and bullying, as well as we just had that class with Clayton last week, and I can send that video over as well. But yes, I do have a lot of good information on that, and I can send it directly to her. So if she wants
Okay.
to email me after this, I can do that.
And I just shared your email in the chat, Shannon, so they'll all have that. There are no other questions. So any other thoughts from you before we close?
No, honestly, I just
Yeah.
want everyone to know that they're not alone in this. It was very, very difficult for me. And I'm someone who doesn't necessarily show how stressed I am. I mean, one time when I was younger, I literally gave myself hives because I was so stressed out. And my mom didn't know because I don't show my anxiety. So being able to talk to someone about this, even if you're feeling remote stress or something that could be building, is so important. And I just want people to learn from what I went through. So just know that you're not alone, that Operation Happy Nurse is here for you, that the ACT program is here for you, that we're all addressing this and that we know that it's hard and we're acknowledging that and we're here for you. And we want to be able to get you through this difficult period of time because I also love nursing and it is hard to be in right now. So we get that and we're here for you. So please reach out to us. Please reach out to the ACT program. Please reach out to
Thank
Operation
you.
Happy Nurse. Please join our community because we really, really want to make this profession amazing to be in.
Right.
And it takes a community to do that.
Now, I have a question for you again, and if she's still here, someone raised their hand. I don't see her now. Um, I'm sorry we missed you, Tina. I was gonna open your mic so you could speak, but okay. Make sure you email Shannon at operationhappynurse.org. You can, oops, I put OG. 1 second. Let me retype your email address in here. Maybe that's what she was trying to tell us. And you can also email us. We can connect you to Shannon at act@ingenovishealth.com. Be more than happy to connect you to Shannon as well. So thank you so much. Honestly, it's been a pleasure meeting with you today and hearing your story, your life experience. I'm glad that you were able to meet with us and share that. And we certainly hope that you'll continue on your journey. You can tell from all the questions, there's a need in different areas, not just nursing. And we're really happy and honored to continue our partnership with you and support nurses and clinicians on the front line. So thank you so much. Attendees will receive future webinar invites and reminders, so stay tuned for that until next time. Thank you all for joining us.